first of all, it's an honor for me to be here and actually be part of, a year ago, we were dreaming of the idea that we would actually be at something like this to talk about the bill passing. And so just to be able to talk about how we got here and where we go from here is a real honor. But I think Bill is actually going to start off, and then I'm sure we'll have plenty of time for questions too.
I thank you to Ann and Kathy for having us tonight. I am more excited than Eric that we're here talking about a bill that has passed than a bill that we hope to pass. Because as much as I'm sure you enjoy Jeff City, I don't care to go there as much as I have in the last 3 years. But I'll come back to say hello.
Yes.
It's an honor to be here. Again, thank you to Kathy and Ann. And then Jill Puertas, with whom I work at Lewis Rice, got the ball rolling for the event tonight. It's very exciting to be here. This is the 60th anniversary of ARC. 8 years ago, I walked into the basement offices of ARC on behalf of my son Will, and have been a constituent, I guess, a client of ARC during that period. It's even more exciting. This is my first time in the new building, Kathy, so congratulations on the move. This is wonderful. What's interesting is this whole train, at least for me, started with Eric's predecessor at that is Senator Gibbons. He appointed a panel in 2007. It was a blue ribbon panel of people from all across the state and all across what I'll call the autism community. There were parents, educators, therapists, legislators, representatives from all over the spectrum. We were in Kansas City, St. Louis, Cape, Springfield, and Jeff City, of course. And Senator Roop, who's not with us tonight, he's getting married tomorrow. That's a pretty good excuse in addition to the weather. Senator Roop was the chair of it, and it was an eye-opener just because the autism community, and I've said this is my impression as a parent, can be a little bit difficult to deal with. And by that I mean the disease creates a circumstance for a lot of people where it is very difficult to deal with anybody other than people who are helping you with your child. And when you find the person who can help you with your child, you don't want to tell anybody that you have that person. Which leads to people who have the ability to communicate in a way that those with autism can't, to do exactly what the autistic kids do and not talk to anybody. And it can become a little bit lonely, and we can become a little bit sensitive to our turf. And the process that began in 2007 moved forward in 2008. Senator Chris Koster, now Attorney General Koster, filed a bill in the Senate. Representative Sam Page, now private practice anesthesiologist, filed a bill in the House, and I learned that if you don't have any help, or you don't have a constituency or a group of people backing your bill, the bill goes nowhere, and neither bill went anywhere. And I was shocked. I didn't believe that could happen. So it struck me that we had to find a way to come together, and we did. In 2008, a group of people got together, and I had to write them all down because I'm going to offend somebody if I don't remember them all, but Autism Speaks, the Thompson Foundation, the Missouri Autism Coalition, MoFeed, what's now Judivine, Becky Blackwell and her organization that is still Judivine, formerly Judivine, now Touchpoint, Ron Ekstrand and the group there, the Ozark Center, St. Louis ARC, the Mercy Health Plan, and then Moaba came in last year. And 2008 was still a little bit uncomfortable. I think you were not yet in the Senate, and these groups were all kind of like, well, what do they want? What do they want? And why are they doing that? And why are they doing this? And there was still this kind of distrust isn't the word, but discomfort amongst the group. And it led to some real problems. It was clear to the legislators that we weren't all of the same mind, nor should we be, but it was used against us. As the session went on, we began to hear, well, you want that, but they want exactly the opposite. What am I supposed to do? So in 2009, we got together, and everybody got together at a table and looked at one another, and we put together what we thought was the best case for a bill. That bill was filed in 2009, and it failed. But over the course of that year, we came together as a group a little bit better, I think. And then, of course, in January of 2010, we got a bill filed and we got a bill passed on the second or third to the last day of the session. And I remember it very vividly for a couple of reasons, both of which, or many of which, have to do with Eric. First of all, Eric is a pretty cool customer, at least in the time I've been with him. And when he called me at 6:30 or 7 in the morning and said we need to go to Code Red, I knew there was a problem. And it had to do with procedurally getting the bill out of the House and into the Senate. And I was a little bit upset at that point because I thought we were going to get the bill passed. We did. But in the course of literally an hour and 20 minutes, the bill was heard and voted on the House floor, and then heard after Eric gave a beautiful speech and passed. And I think I'll get into the details. Most of you probably don't care about what I just said, but it's important for one reason, and that is it is impossible to make policy or to affect policy unless you can get a group of people like this group of people in a room together and come to some kind of agreement about how you're going to present what you want from the legislature. If we're all going down there piecemeal without any plan or any agreement amongst the larger group, I think it's hard to make policy, and I'm sure Eric can comment on that. And when I was thinking about tonight, thinking about the process we went through, I thought that how appropriate that the Beatles are now out on iTunes. The song "Come Together" comes to mind. I mean, this group of people did not get along 3 years ago at all. Everybody was worried about the kids. Everybody wanted to help, whether a therapist or a parent, but everybody felt that somebody was trying to get something for themselves. And over the course of 3 years, I think everybody learned how to work together, how to speak to one another in a way that they could air out differences, and we really presented an incredibly united front. And it culminated on the day that Eric went to Code Red. I called this group of people. I said, we have got to call Speaker Richards' office right now. And we've got to let him know that we've waited 3 years to have coverage for a disease that is more deserving of coverage than most others, or at least shouldn't be discriminated against in the way that it is. Like that, the phones were ringing off the hook. And what was great about it is the Speaker's office called Autism Speaks and asked us to stop calling. To which Rebecca Fehlig wisely responded, we're not going to stop calling until the bill is, a procedural motion had to be run through whereby a committee was set up to resolve the differences between the House and Senate bill. And the guy said, well, we've already done that. And Rebecca said, no, you haven't. We spoke to the whoever 2 minutes ago, and you haven't done it. We'll stop as soon as you're done. Well, the guy hung up on her, and it was great. But everybody in our group knew exactly what was going on throughout the entire time period, and that constant level of communication we had. We were on the phone every Thursday at noon for the entire legislative session in 2010 and in 2009, and that just the communication in these types of gatherings foster relationships that would not have otherwise existed, that I hope will help the community move forward. In terms of the bill, one of the misconceptions, and the Department of Insurance is I think, abetting this a little bit, is that it's an ABA bill. And the bill is not an ABA bill. The bill mandates the coverage for state-based health plans for the diagnosis and treatment of autism. It doesn't mandate ABA. It mandates that in the context of a physician's treatment plan for a child diagnosed with autism, that those things included in the treatment plan are covered by the insured's plan. Now, a lot of this is going to play out over the next couple of years. It's not going to be perfect. There will be denials. Things will not go as we probably would like them to. I was in D.C. in October for a national conference with others who are going through this process or who have gone through it. And in the 22 or so states where implementation is taking place, you hear stories that are no different for a person with autism than a person with, emphysema or some kind of illness. There are denials. But I think, the traits that helped us get the bill passed, patience, persistence, collaboration, will help us get through the implementation process. The other thing, well, it's not an ABA bill. ABA is a big part of it. And Missouri is a state in which licensure of the ABA therapist is required as a precondition to reimbursement for ABA therapy, which was very controversial because it didn't exist anywhere else. That being said, the Department of Insurance did a wonderful job of soliciting comments from the community after the session was over, and they have implemented emergency rules for ABA therapist licensure that went into effect December 10th, so that if I'm an ABA therapist, I can go and apply for a license now, and then in turn go to the insurance companies and seek certification and become a provider through their insurance plans. And I'm sure that that's going to work itself out over the next several months. Final rules will have to go in place 120 days from December 10th, and I can't do the math here, but I guess that's about 4 months. So far, there has not been a tremendous amount of controversy about the rules. The folks from OABA with whom I've spoken seem to be pleased with how things went. They were stakeholders in the process. Their comments were solicited, and I think things went well. Our only concern was a statute or rules being drafted that would be problematic for not only us here in Missouri, but also other states, because we're the first. We'll look at ours and just copy them. That's kind of the essence of what Eric and I do, practice the law. It's a little bit of copying of stuff that somebody else did in the past. But I think this licensure statute, from what I can tell, will be a nice one to be used in other states and should not be a barrier to access to care for those with autism. The final thing I'll say is I can't tell you as a parent, as a lawyer, and notwithstanding the fact that he went to the Spen and I went to Chaminade, how much I appreciate what Eric did. This is true of Senator Root. This is true of Representative Scharnhorst, but Eric and I are coming from the same place in a sense, and he was a very good friend. The code red I didn't appreciate, but it ended up working in our favor. But I in a public forum, I haven't been able to thank Eric, but I think all of us should be very thankful that we have a person who is affected as a parent, who understands what autism is. It's every day. And he was able to convey that message to his fellow legislators in a way that probably made this bill not a possibility, but a reality. Thank you.
I feel ambushed by Bill there. That's very nice.
How many has the Smet beat Chaminade any sport this year?
I'm sure
no.
they have. I'm sure they have.
That doesn't happen very much, so I'm going to take it while I can.
Yeah, as Bill mentioned, I was elected in 2008, and Stephen, who is on the autism spectrum. He was diagnosed at 5 months. He was born in 2004, and diagnosed at about 5 months with a condition called tuberous sclerosis. I don't know if anybody here knows what that is, but it's a genetic condition where tumors are formed on different organs: the kidneys, the heart, the brain. They're not cancerous, but they cause all kinds of problems, particularly if they're on the brain. And Stephen has them everywhere. And we went into a routine dermatologist meeting at Children's. I probably should have, when we were referred to Children's, I probably should have been a little suspicious, but it was our first child, and you know, you're not expecting to hear anything like that. And it took us a while to get in to see the neurologist at Children's, and so you have months of, you know, going on the internet, and the parade of terribles is laid out for you. And it was a really just a rough period in our lives. And he also has pretty severe form of epilepsy, which is pretty common with TS. And of kids with TS, like 80 or 90% are on the autism spectrum. We kept finding out that all these like crazy odds of everything that could, Stephen was falling into all of those categories. And so it was very, very difficult as a parent, and he had life-threatening seizures later on that year. He had a 4-hour seizure at Children's. He was on his last medication that they could to stop him before they were going to induce a coma. It was rough. And so the autism thing was sort of out there. You know, we were dealing with intense medical life and death issues. But a lot of the medication he's had for the epilepsy has worked to some degree. He still has seizures every day, but they're not the life-threatening kind. And Stephen's 6. He's nonverbal. He has a lot of challenges, and will. I mean, I pray every night that you know, magically all that stuff goes away. But you know, he's dealing with a lot of stuff, and so that was. I mean, so before I ever ran in 2008, I mean, I was just a dad. You know, I was a dad, and Mike Gibbons. It's just ironic. Mike Gibbons, who preceded me in the Senate, you know, he created this blue ribbon panel, and I met with him one day in 2007 about helping. He was going to run for Attorney General, and I wanted to be helpful. And then, you know, he kind of put the bug in my ear about, you know, with term limits now, you're only around for 8 years if you're reelected, and so. So I started to think about that, and because of my experience with Stephen, you know, there's a lot of things when you run for office that you want to accomplish, but those issues are, you know, kind of front and center for us. It's what we deal with every day. You know, when we go home at night. I mean, that's what, you know, I look forward to that, but that's what we're dealing with. So having that perspective coming in 2009 is Bill kind of laid out that timeline. My legislative career, you know, came into a collision course with this legislation that was starting to gain some real momentum through the efforts of people like Bill and a lot of people in this room and across the state. And I remember the first day, so in 2009 we passed it out of the Senate 29-2 in 2009. But it didn't get a vote in the House, and that kind of set the stage for the rallies we did last year, and then ultimately in 2010 when we were able to pass it. But I remember sitting in my office and really, you know, thinking and going back and forth in my own head of what I was comfortable sharing, you know, on the floor there, of how much of yourself do you really you know, put out there, because it's in the paper and it's your family and everything else. But I just didn't feel like I could be honest with myself and pay tribute to a lot of the folks that go through the same thing. I mean, that is, you go to the legislature, and the idea of a citizen legislature is people bring all of their life experiences there, and you only meet 5 months out of the year because you want people who are lawyers and teachers and farmers and all kind of walks of life to go up there and try to, out of all that stuff, come up with some good things for the state. And so, you know, I just made a decision that I was going to talk about it. And it was very emotional to actually do it for that first time. Talk about what it's like every day, you know, to hold his hand and help him walk upstairs. I mean, that perspective before I was a parent of a child with special needs, until you live it, it's just hard to understand what it means every minute of every hour of every day of every week of every month of every year of your life. And so anyway, Senator Roop had sponsored it and had chaired the Blue Room panel and did a great job. And ironically, Representative Scharnhorst, who may or may not get here in time, he had a grandson who Bryce, who had epilepsy and autism and died at the age of 6 through a really, really bad seizure. So Dwight and I share, some things also, just personally. And I think that in that environment there in Jefferson City, and we'll get to the details, and I know there's a lot of questions on what does this really mean for family, because that's why you guys are here, and I get that. But to have, there's so many things going on there. There's 1,500 bills filed a year. I think last year 105 passed total. And there's a lot, and every senator, every representative has their own list of priorities. And a lot of times those priorities don't include requiring insurance companies to do things. Because I'll tell you, they got, I'm with them on some things and not with them on others, and that's how it's supposed to be. But, they're paid to do a job too, and they certainly didn't want this to become a law. It was an additional mandate. But when you started to educate people about, look, of the top 12 neurobiological conditions that are out, this is the only one specifically excluded from coverage. 1 out of 90 kids now are being diagnosed. 1 out of 58 boys are being diagnosed. People are starting to have, even if they're not directly affected as a parent, they know somebody now who's been maybe diagnosed, or they have a niece or a nephew or a grandson. And so it's really hit close to home with a lot of people, and to bring that perspective was important, and make sure it's kind of stayed on the radar screen. We did some of those rallies. I noticed there was the Show Me Autism Coverage Now t-shirt. We had those rallies last summer, and all that stuff, you had to just make sure that it remained a priority, because it's a long session, and inevitably the important stuff comes down to the last 2 weeks. And you try and just do everything you can to set the stage. And we had a really, Bill really played an instrumental role on keeping a lot of the groups together on this, because if you didn't have that, that would have been used against us for sure. Which is to say, well, you guys don't even agree on what it means, what the age, what the cap and coverage ought to be, and what if we should have a licensure bill that was sort of almost a poison pill this go around. It was placed there to say, well, shouldn't we figure out all the licensing issues? Yes, but some people knew that some people had some significant issues with it, and if that was a way to kill the entire bill, it was something that was kind of thrown out there. So you're weaving in and out of all these things every single day. And I did write down, I went on a retreat a few weeks after session was over. And I wanted to make sure, and this wasn't the best way to unwind, by the way, but I wanted to relive all the things that had happened in the previous 4 months, so that 30 years from now, I can remember how difficult it really was to get this thing passed. Because what will happen is, you'll just sort of gloss over all of those things and say, oh yeah, well sure, why wouldn't you cover therapies for kids with autism? That makes all, but it wasn't that simple. So the bill, as it made its way through, we ended up with, everything that was really important to us to make sure it stayed a good quality bill, because I really wasn't interested in having an autism bill that you could hang up on your wall that didn't do anything for anybody. That didn't interest me. But I also knew that every year has its own sets of priorities, new leadership, and everything. And there's so many unknowns that if we didn't get it done last year, you just don't know when or if you'll ever get it done. So we were able to cover the therapies up through age 18, a $40,000 cap for the ABA therapies. All the other therapies, speech, physical, occupational, all those things that Stevens had too, those aren't capped. The ABA component was one that was controversial, and how much is enough. And one of the things that we were able to do, which I'm pretty personally proud of, that we worked on together very closely, was we have a cap. But I think we're the first state in the country to have a cost of living increase. So that $40,000 cap, what it means in 2011 is what it'll mean in 2020.
We're the only state.
We're the only state that has it. And oh, by the way, one of the other things that's in there, that if you can prove it's medically necessary, actually the cap doesn't even really apply in that regard, because the idea, of course, and this is the medical necessity component was critical. Clearly, insurance companies aren't going to pay for therapies that aren't medically necessary. But if you have a doctor that says it's medically necessary, it's going to get covered in Missouri, and that's what we wanted to. And it was the ultimate safeguard from what insurance companies perceived as potential abuse. But at the end of the day, we have a bill that provides the really critical therapies for kids, for ABA, for speech. It can't be denied. The diagnosis is covered. And it really, in my view, and my hope is that it's really a pathway, because we all know, in this room I think, know that the earlier you can intervene, the cost of treating of an individual with autism that goes untreated early. I think there's a Harvard study that it's a $3 million, is that right? $3 million cost to society. I don't remember the number. It's been a while since I was citing these things off the top of my head on the floor when you were asking questions. But the earlier, obviously, you can intervene, it mitigates a lot of the more expensive therapies down the road. And that's what we had to do to really make the case for the bill, because there is a cost to it. It's minimal. It's less than 1%. But when you balance that with all the people that it's going to help, all of the money that it saves down the road, and all of the generations of kids that will actually have an opportunity to say I love you to their mom and dad because they get therapies from a lot of the great providers we have, it was well worth the fight. And Bill, and I don't want to make this the Mutual Admiration Society up here, but look, I got elected to do this. This is in a sense my job. Bill is not, that's not what Bill's a dad and cares very deeply, and worked really, really hard, and had an expertise in the background to really, in critical situations, step in and provide, from a legal perspective, from a father perspective, a lot of what we really needed. And this just doesn't get done without him and a lot of other people. Everybody had a role, and I was very thankful that it got done. So anyway, I think I'm sure there's questions, and it's probably the right time to open it up.
So I won't be shy. You mentioned specifically that speech OT does not have a cap that ABA does. However, what situation applies if you're not getting denied coverage today because of autism, but you're getting denied after a certain number of visits?
There's no cap.
A low number of visits.
So visits to the medical doctor or sessions with a therapist?
Is capped 25 combined PT-OT speech, which lasts 5 minutes. So even though they're covering it, it's not covered more than that many number of visits for my plan.
Right.
So does this help in that?
Well, actually, that brings to mind probably the biggest point that has to be made. Remember, the bill that passed this year is only applicable to state-based health insurance plans, which means about 25% of the insureds in the state of Missouri, or 30% of the insureds in Missouri, are on a state-based health plan. Everybody else is on a federally regulated, quote-unquote, ERISA-based plan or a self-insured plan. So the first question you have to answer for yourself in the context of coverage is whether or not your plan is state-based or federally based.
So this only applies if it's not self-funded?
No, it only applies if, effectively, unless you work for the state of Missouri, a school district, or a state-based plans, which is a relatively smaller subset of insureds than federally based plans. Depending upon who you talk to, well, you're not, the rules in the bill that passed don't apply to the federally based, ERISA-based, or self-insured plans. Now, there are 23 states that have passed this legislation, and what the goal here is, and you'll see it play out in 2011, is once we get past the 25th state, we've made a case where we can go on a national basis, so the national arc Autism Speaks, other nationally based autism groups go to Congress and say this is a joke. 25 of the states have passed this. You passed a health care law last year. We need to do this. And that's kind of where we're headed, at least from the perspective of Autism Speaks on a national basis. The state plan to get all these states' bills passed feeds into the plan to get a national bill that is similar to the one we have here. And there is an argument that the Affordable Health Care Act, in the context of one phrase of 7 words, requires the coverage of ABA therapy, and additionally the Mental Health Parity Act, which passed prior to Pete Domenici retiring from the Senate, also requires coverage of these therapies. The problem is you need a full-time lawyer in your living room to battle the insurance companies to make those arguments. Now that's not to say that it won't happen. Furthermore, there is an effort going on amongst the coalition that helped pass the bill to go out to self-insured and ERISA-based plans throughout the state and say, this is the right thing to do, please do it. Children's Hospital in Kansas City now on their health plan covers it. Mercy Health Plan, or the Mercy System of Hospitals, which is based here in St. Louis, now all of its employees through their insurance plan are covered. There are other companies that I'm not going to remember as I sit here, but you know, as delicate a conversation as that is, we're trying to go to leadership at companies throughout the region in St. Louis and others doing the same, Kansas City, Springfield, et cetera, trying to get coverage. So that's that. I've answered questions that you probably didn't care to ask, but it's very important to understand.
No, that makes sense.
Yeah, the bill basically covered everything that the state could require. We can't require the ERISA plans, which are governed by federal law, to follow the bill that we passed in Missouri. That has to come from Congress. And depending on who you talk to, 30 to 40% of the plans in Missouri are covered by the bill, including the state-run plan. The hope is, of course, as Bill mentioned, that once you start to get that critical mass of the number of states, and this is borne itself out in other types of things like this, that then you have the ERISA plans then follow suit. So.
Right over here.
Yeah.
What is the definition of a state-based plan? You mentioned school districts. The school districts use Anthem. Anthem is not a state-based. It may be state-run, but it's not state-based. So how would you know whether you've got a state-based plan or not?
You go to the human resource director wherever you're employed and ask them that question. And I'd be willing to bet they won't know.
They don't.
But let me finish. So Anthem is a nationally based company, but Anthem also issues policies that are regulated under state law, so that it can do both. I mean, Anthem can be the insurance company for an ERISA-based plan, but also be the insurance company for a state-based plan. So just because you're with Anthem isn't the end of the inquiry.
Then the subsidiary question to that is, how do you know whether your Anthem, like you said, you go to the personnel person and they're not going to know?
The answer to that is Melissa Palmer is the legislative liaison with the Department of Insurance for the state of Missouri. Melissa sent us some information, and her handout was at the desk. And the Department of Insurance, it's their job to help you determine the answer to those questions, and they can't answer that question. And I encourage you to go to the Department of Insurance. They have a frequently asked question link. And then there are people within the Department of Insurance whose job it is to answer these questions. And I would strongly urge you to use them. I mean, my impression of the Department of Insurance...
Has that frequently asked question
Yeah.
sheet.
But it's answered opposite of what you're saying. This handout that we just all have, the question is, I live in Missouri, but my family and I get our health insurance through my employer based in another state, and our policy was issued in that state. How does this bill affect our family? The answer here says, if the health insurance policy is written outside of Missouri but insures Missouri residents, it must comply with the new law.
Yeah, that's right. So if it's covered if it's a state-based plan, okay? If it's a state-based plan, it's covered. If it's issued in Kansas, but it covers, this is more applicable on the Kansas City side, but also could be in Missouri. But if it's insuring Missouri residents, and they're still working through the Missouri Department of Insurance, it's covered. What Bill's talking about is, this is not a true across the board, but a decent rule of thumb. The larger companies, the Anheuser-Busch's, the Monsantos, are usually the ERISA plans. The more medium to smaller sized businesses usually are more get their insurance through state-based plans. So under that scenario, that's right, and that's one thing we wanted to make sure, that you couldn't just be we were covering people who lived in Missouri if they weren't governed by federal law.
And one of the provisions that came into the bill and thankfully was excised was just what you talked about. The insurance companies wanted a provision stating that if the policy was issued in Kansas covering a Missourian, they wouldn't have to comply, because they said, well, it's a state-based plan, but it's state-based in Kansas, not Missouri. So, but again, my impression of the Department of Insurance throughout the process was a very, very positive one. I mean, they couldn't take sides, I don't think. But they were very, they solicited our opinions. They wanted to know what our concerns were, what our problems were. And throughout the ABA licensure drafting, they listened to MOABA, they listened to ABA therapists. And counter to the cynical feelings that some of us might have about governmental agencies, I think this is one that really cares to see this bill rolled out and effective in practice.
Yes, sir.
First of all, thank you very much for passing this bill. I mean, I know a lot of us and every one of us, every child will be thankful ultimately in the future. I have two questions. You mentioned about speech OTPT therapies and the medical necessity of those. Now, there are other therapies like hippo or aqua or music therapy, which are also sometimes medically necessary. Now, are those covered here? That's the first question. And the second one, on the same line that the other lady asked, my company is headquartered in Virginia, and the insurance is based out of there. I live in O'Fallon, Missouri. Is this covered? I mean, will this be covering my daughter?
The answer to that is I would be willing to bet that your plan is a federally based plan, so that the bill.
It's a United Healthcare, so I don't know. I mean.
Right, but I don't know the answer. Your HR department will be able to tell you whether it's an ERISA-based plan or a state-based plan, and that will lead to the answer as to whether or not this bill would be applicable to your plan.
Okay.
As to what is medically necessary, that is, it's not the third rail, but it's. You have to put yourself in the shoes of the treating physician, who is going to write the prescription, write the treatment plan on the basis of what is medically necessary. And what is medically necessary will be based upon his or her review of the literature as applied to the particular child. So I can't tell you that music therapy is covered. I can't tell you what therapies, if any, are covered for your child. But I do know it is incumbent upon us to inform the doctors of what is medically appropriate. I'm married to one, so I can be critical of them, right? Doctors need us as much as we need them, because I know from experience that the first physician that we were with, pediatrician we were with for Will, did not want to diagnose him with autism. Absolutely didn't want to do it. And Tricia knew it, but she didn't have her doctor hat on. She had her mom hat on. She said, "We've got to fire this guy. He doesn't know, he doesn't want to know, and he doesn't want to help." And I think it's important to remember that doctors are humans. There are no, they're fallible. A lot of them don't think they are. But if you have in your gut a bad feeling about a doctor, you got to go find a new one, because this is extremely important stuff, and you have to find the physician who either understands the topic and can write a treatment plan that's consistent with what you would expect for your child based upon what you know, or find a different doctor. We gave away a year, at least a year, where Will could have been treated in a way that, had we had the current pediatrician we have, I think would have been a little bit different.
Well, and on the flip side of that too is, I think there's also a reluctance too among many parents to actually. The flip side of that is to actually get the diagnosis because of the stigma that often exists, and you go through this process of denial where you don't want to believe, especially when they're young and you don't, and the symptoms haven't completely manifested themselves. And so, as everybody here in this room knows, that nobody is going to advocate for your child unless you do. And that goes for not only this, but also with IEPs. I mean, one of the, not to go off on too much of a tangent, but one of the other bills that I filed too was, and we got passed, was this Parents' Bill of Rights. I'm a lawyer. My wife was a teacher in Webster Groves for a number of years. And when we had our first IEP with Steve, and we've had a great experience with Kirkwood School District, a great experience. But when they give you the procedural safeguards, it's like 28, 29 pages. And when I testified for the Parent Bill of Rights, I said, this looks more like a lease for the school building than it does for anything else. And to get through that is, and people don't know what questions to ask. They don't know what services are available. We still, I mean, look, we still struggle. This may be the signature bill that I fondly recall 20 years from now. But believe me, we still wonder what you always want to be doing more for your child, and what are those services out there? What's covered? And unless you're asking those questions, and I'm not sure we'll have all the answers up here today, but and it's a lot of work and it's a lot of time. You could have, when we were dealing with the insurance company. Originally, when Stephen was diagnosed with a lot of stuff, that was a full-time job dealing with a lot of those issues, and so you guys know that.
And I will provide a more cogent answer to the ERISA versus state-based plan, and I'll give it to Ann. I had it at the Law Summit, and it's like that nightmarish the Venn diagrams from grammar school, right? It's kind of like that, and I'll send Ann the description of, or the distinction between the plans, so that Ann can put it on the website or email it out to everybody, because I do have something that will be helpful to you, so that when you go into the HR director, you're just as informed as you are going into the physician trying to get.
Yes, sir.
I'm sorry. I think she has a question.
Oh, I'm sorry.
I think she has
the
answers.
I can try to explain to people the ERISA state. I am a lawyer.
Okay.
So I think Senator said it exactly right. Typically, just as a rule of thumb, the smaller companies will buy insurance from United, Aetna, whomever. So the insurance companies both issue insurance and they administer other people's plans. So the bigger companies can have a big pot of money, and they can, under a federal law called ERISA, say, okay, this is the pot of money for our health plan. You, United, Aetna, whomever, go administer it for us. So to you, it looks just like United is providing the insurance, but they're not. It's your company's pot of money. So it's self-insured. And so, as a rule of thumb, the bigger companies or the medical institutions or the universities will have a pot of money that they've set aside under federal laws, and somebody else administers it, but to all of us, it looks just, well, I have United and you have United, what's the difference? That's the difference. The smaller companies will buy insurance from United or whomever, and the bigger companies have their own pot of money. To us, it usually looks the same. In this case, that's where the differences are. And so the quick rule of thumb, that's why it works. And that's kind of why, so you might go to HR, you might say, this is really important, can you check with legal? Legal will know
how it's run, because there are all sorts of regulations people need to comply with. So it's not like somebody won't know. You just have to get the right person to know.
What if
So-
what if it's, like, you keep saying go to HR, like, my husband works for a group of like 40 people, there is no HR.
A group of,
I mean, he works in a small group of doctors, only 40.
Whomever is responsible for purchasing the company's insurance
somebody
coverage.
is responsible. These things don't just happen. There's somebody who either has to research which insurance company they're gonna use, or somebody who has to administer these
Okay.
things. They're not,
Yeah, because
they're
we
not
usually
on
bid it
their
out
own.
every year anyway.
There's somebody responsible,
And-
inside or outside.
Okay.
that will know.
And
But I
even
do have
if-
a question too.
Even if federally based, they can add it on to their, suite of services. It's not as if they're banned under ERISA from having the coverage, they just have to add it on because they're not presently
Right,
obliged to
so
have it.
it's just, the difference is, the state has the right to force those who take advantage of the state insurance laws, which is the, the smaller ones and whoever operates insurance in the state has the right to say, okay, this is what you're going to do. Other people can choose to do it, it's just, it's money, and so, right, so that's,
So you think, like Washington University, United Health, that would be a federal?
I can,
They're
with,
self-insured.
they are self-insured. Now, for WashU, you can make a damn good argument, just like somebody was saying that it's unconscionable that a university that is so heavily involved in autism research does not cover treatments for autism, right? I mean, go to talk to all these people, and, but WashU does not have to do this because the state rule does not apply to the Washington University insurance plan. That doesn't mean they can't, they should.
So you're pretty sure they're federal?
I don't work for WashU, so I can't swear to it, but I am fairly certain that WashU, SLU, the hospitals are
Right, but
not.
Mercy
Well,
did what
Mercy's
you would
choosing to
assume
do it.
WashU would do, but right.
Right, I mean, but WashU, for God's sake, for all of us who, right, but anyway.
And your
So,
question?
My question,
Thank you very much.
medically necessary, so most of us, or at least I, my pediatrician had no clue and swore up and down my child didn't have autism, whatever. And so we found out about ABA and we're doing all these things privately. No, so we see specialists, they're not necessarily medical doctors, so are we gonna need,
Specialist in what kind? You mean a therapist?
well, no, a therapist, but what is Thompson Center? Is he a medical doctor?
He's
So
a
we-
second. Stephen?
Is he a medical doctor? Oh, okay, so then, but you need an MD to prescribe it. This is the construct that we're working in, so just but the pediatrician is gonna say, well, I don't know from ABA.
You know what though, I think but it's incumbent, that's the point I'm making is, you gotta go back to, as it relates to ABA, put everything else aside, ABA is done. The literature as it relates to ABA is sufficiently deep and that you can say, listen, it's all there. The problem won't be getting the problem for the physicians, to my mind, will not be whether or not to prescribe ABA. The problem will be how much ABA they prescribe. Okay, because I want 40, he wants 20, we agree on 30, and then the insurance company says, no, we'll give you 10. Well, then what? That's part of what's going to occur over the next couple of years as the claims are filed and denied, but I can't emphasize enough how important it is for you to go into the doctor's office with your own treatment plan ready to go and have the ability to describe to the physician what you want, because they're to a certain degree have it worse than lawyers. That their only time is inventory. But as opposed to Eric and I, who can say it's going to take us 2 hours, the insurance company says you have 15 minutes to see this patient. After that, we're not paying you. So you're in there with this kid who can't sit still. You're freaked out, and he's only got 15 minutes. How's it going to get done? That's why I think going in there loaded with information is the best way to do it, because then you've helped the physician and maybe come to decisions that he or she might not have otherwise come to.
But it's an MD is the,
That is correct, so that the treatment plan has to be coming from a medical.
The best way to look at it is that they're sort of the gatekeeper here, and then after that, you can go in a bunch of different directions, but that's it has to be medically necessary.
and it doesn't have to be a pediatrician though. It could be a neurologist.
It'll be your treating physician,
Could
right?
be,
There's a question over here in the booth.
Yes, sir.
I've got the MD part covered. I'm set. The problem is my MD's in Florida. So, she's fantastic. But can she write the prescriptions even though she's not based in Missouri? I mean,
I don't think that's a barrier.
Okay.
If she's the treating physician.
She's, I fly there all the time.
Is there anybody, I don't know that for certain.
She's a licensed MD, she's a pediatrician, she's got a child with autism, and she's fantastic.
Is there
The bill has the phrase licensed to practice. I don't remember if it says licensed to practice in Missouri, but that, you'd have to look at the bill.
Okay. Is there
Now,
somebody
it
else-
would be issue, but remember, the physician will have to contract with the insurance company that you access healthcare through,
So she has to be participating physician with
Right.
the insurance company?
just as the
She
ABA
couldn't be an
therapist would be.
out-of-network physician?
But she could be an out-of-network physician.
Yeah, like right now, we file through out-of-network with
Okay.
her, and we get some stuff, but of course she's careful enough to never ever use an ICD-9 code of autism,
Right.
and always use procedure codes for yeast overgrowth and things like that. So, I guess I don't probably have the answer fully, right? I need to read this bill to
No, you
determine
don't.
whether or
You
not.
Well,
just need it, just email me and I can give you because I know exactly where in the bill. I just can't remember whether it was licensed to practice in the state of Missouri or licensed to practice. I think it's licensed to practice.
Okay, thank you.
Yes, ma'am.
How does this affect individual coverage? We have individual coverage through Anthem.
Yeah, it is a mandated offering for individual coverage, meaning it's not required to be provided. You have to pay for the coverage, and so the individual, it's tougher because it's just going to be much more expensive. But to answer your question directly, it's not required to be covered, but it is available for coverage to
So
purchase.
do they, I mean, it's available, so they, anything paid or?
What's that? I'm sorry.
Is anything paid on it, or how does that work?
Well, no, you can purchase the cover so that the coverage, and correct me if I'm wrong, Bill, but you can purchase the coverage like you would have, let's just say you worked for Shop and Save, and they're a state-based plan. It's required to be covered, so it's already sort of calculated into their risk pool. What if it's medically necessary, it's covered. In the individual marketplace, that isn't the case, meaning they don't have to cover autism therapies if you don't buy the autism rider.
There's a question here. Oh, I had a suggestion about the medically necessary. The Department of Mental Health, the Office of Autism Services, which was, involved in the Blue Ribbon Panel and has been involved in all of this, has the best practices guidelines that were established by the Missouri Autism Commission. It's a good place to get information to take to your doctor and go in and say, this is what California and many other states and now Missouri is saying is how we should diagnose and treat autism.
Right, and that's the book. I mean, it's not like it's
a book.
Outstanding book. No, it's wonderful that you guys rolled out this summer, right?
Yeah.
And that's.
Is that available on the website?
It's available on the website. If you go to the Department of Mental Health website, the Office of Autism Services, there's so much information there. It's amazing. And for those of you who are service coordinators from the regional office, they don't all get it either because they don't, they're not as dedicated, they're not as focused on autism as everyone in this room is, unfortunately, unless they've been affected themselves personally. But go there yourselves then and get that information. Go to the Office of Autism Services and look for the guidelines.
If the St. Louis ARC, when we put this video up on the website with the link, we will also put a link to that space on, that you just talked about, through the DMH office. We'll have a link there on our website in the next couple of days, so take a look there.
And Gay Thompson kicked me in the shins because that was a two-year
Yeah.
work of art. It's wonderful. and I'm embarrassed that I didn't think of that.
Yeah. Oh, it's scarf.
Does this bill help, give any additional help to those who are over 19?
It doesn't require coverage over 19.
Well, now, wait a minute. So the age restriction and the monetary restriction is applicable to ABA
That's right. That's
only.
Right. Yeah.
So as it relates to adults or you know, people over the age of 18, the mandate remains, but it does not remain in the context of ABA therapy above the age of, I think it's 18 or 21.
It's up to 19, so through 18. You're 18 years. Yeah.
So over 18?
Is not required. ABA therapy is not
What
required.
about further therapy?
All of those are just as they would be for any other condition. That is, if the physician, the treating physician prescribes speech therapy for a 24-year-old on the autism spectrum, and it's a state-based plan, the insurance company is required to cover it.
This lady here with autism covered shirt and then pink.
I think you just answered my question. This insurance bill is for all autism spectrum disorders. Is that right?
It defines autism spectrum disorders in a way that is consistent with the diagnostic, the DSM, DSM-4. So the answer is, if we didn't cover it, the community of physicians who define autism haven't covered it. Our concern was, if we had a static definition, we might give away other illnesses that will become a part of the autism diagnosis. So it's by reference to the DSM, which is going to be updated, I think, in the next year or so.
And what is DSM?
It's the Diagnostic Something Manual, and it's kind of it's a manual. Yeah.
So if you're the spectrum, if you're talking about from Asperger's to sort of
To Rett syndrome?
Rett was included in the definition, actually.
What about PPD?
That was included also.
Just a quick question. Do you see that maybe in the future, there's so many children in Missouri who are on CHIPS, who are on Medicaid, who don't have parents who have insurance? Do you see that the Medicaid plan may change so that they could cover these therapies for children who don't have insurance?
it was part of the discussion that we had last year, and one of the things we wanted to make sure with the budget situation, anything with a fiscal note right now is just incredibly difficult to pass. We worked very hard on this bill specifically to have the fiscal note. But one thing we wanted to make sure we did not affect, and we actually kind of cleaned this language up, there is a federal Medicaid waiver right now. It's maybe not as expansive as some would like, but this still keeps in place and the waiver system so that folks on Medicaid can get a waiver to have this coverage provided. And that's something that we'll continue to obviously look at.
$22,000 is the cap on that waiver.
Well, how much is it?
It's $22,000 is the cap on that waiver.
Okay.
The slots are limited.
Oh yeah, no, it is. Yeah.
But that's not to say that there aren't still slots available.
Right. Right. Yeah. Yes, ma'am.
I've got one comment and then 3 topics you might want to touch base on. When we went to the neurologist for the first, by the time we were finished, it was the 3rd one. And he had, you got to educate him as well as he has to educate you. And what we found out that, I said, what would you recommend for speech therapy? And he said, 7 days a week, an hour a day. I said, can you put that in writing? And so I took it to our IEP. And Harry had one of the best, or the most speech therapy in a public school for the week. So just know that when you do go to the doctors and stuff, get everything in writing. And also, even though this is a medical bill and it's not an educational bill, you can kind of use it the other way. But I would like you guys to get on a couple different topics. One, if you, and I don't remember what the results were for the small business opt-out, if you could just give us a brief description of what that is. The other thing is a big can of worms of once you do get your prescription and you go to actually get it fulfilled, or, what do we need as parents to know as guidelines of who has the credentials to give out those services? Whether it's an ABA licensed person, RDI is another one. We fell into a huge trap that we went and got RDI. We were told it was going to be covered, and when they went 11 months later, said, well, if you did it with a social worker or with a speech path, it wasn't covered. So where do we find how we find those credentials when we go out and look for our services to be fulfilled? And the third thing is that, is there anything we need to be doing? We're ERISA, so we are not covered. And so is there anything that we need to be doing, like filing still and getting the declines and keeping records for you guys so that you have more, bang for your buck when you want to go to the national level of everything? Is there anything we can be doing in the prep, because we only are, 4 states away, but we thought, last year, we thought so many of them were going to get it, and they did it. So what can we be doing on the ERISA side? Do we still keep asking? What can we do to make sure we're prepared when we get to that line?
The last one is you're touching on something that really seems to me the most important thing about the next several years. That is, in the absence of families who are beneficiaries of the law on a state level, and families who are at a disadvantage by virtue of being in ERISA-based plans, in the absence of those denials and how things go, so we have the context, we don't have a story. So it's going to be incumbent upon the coalition of people who got the bill passed to continue to work together to gather up the stories of denials and how the insurance companies have treated the bill, because the more concrete evidence we have to present to the legislature, and more particularly to the Department of Insurance, the stronger our arguments will be to go back and reduce the denials and kind of streamline the submission process so that you don't fall into the traps. We have to know our insurance plan better than we ever cared to. Because if we all had healthy kids and we were healthy ourselves, we wouldn't have to know it, right? But that's all we can do. But I agree, in the absence of us gathering data on claims and denials, we're all going to be just as we were 7 years ago, just thinking, God, I've been denied. What do I do now? As to licensure, the ABA therapists really, so speech therapists, occupational therapists, speech, OT, physical therapists are licensed in one way or another in the state of Missouri right now. And in turn, they take those licenses to the insurance companies in order to reimburse. ABA therapists, that is people who have received certification from the Behavior Analyst Certification Board, will now in turn be just as are the speech, OT, and PTs. So they'll go to the insurance companies and become providers with them. So you'll know in the context of your insurance plan whether they're licensed, because if they're licensed, they will be able to become providers of the insurance plan. But it's a question that you could ask if there are any therapists in the room right now that can tell you how they got their license. And I suppose as a consumer, you can ask anybody that you're getting care from whether or not they're licensed by the state. And then, what was the first?
The small business
The small business opt-out was if you're 50 or fewer employees, if you can demonstrate that you're, because of the autism requirement, the coverage requirement, that premiums have increased by over 2.5%, then you can opt out. The experience in every single other state is that it has not risen. In fact, the average increase, we had it actually, it was 0.08% increase, and it was actually, by the end of the time, it was actually lower than that. I want to say it was 0.06% increase. So it was to address a concern that just simply hasn't borne itself out anywhere in the country.
So they're obliged to say they can't.
They have to demonstrate to the Department of
Right.
Insurance. So there is a process by which to prove that your premiums have gone up to an.
Based on just autism therapy.
Yeah, just on that. It can't be, because everybody's in premiums are going to go up by more than 2.5%.
It's not a unilateral right, though. That ability to exclude it from the plan is something that they have to seek permission from the Department of Insurance to have and do. In the absence of that approval, they'd be violating the law.
Right, and to your point that you made earlier about the denials and keeping record, the other thing I would say too on when you in the educational setting with your IEP, even if you ask for something and you don't get it, I would make sure that that's written down that you asked for it, because what you want to be doing is building a case over
Or
time.
you can, if they say, no.
Say, no, he's not.
Just say, that's fine, just put it in
Yeah.
writing for me, and you'll be amazed how they bring the topic back up.
Right, because if you don't, because if it's not there, if there's not a paper trail, it didn't happen.
And then the Department of Insurance website that we're referred to, I think, in the materials we handed out, puts us right to the PDF complaint form, which I gather some of us will be filling out.
Yes, ma'am.
Is there anything that requires the insurance companies to make ABA providers a preferred provider? I went to my insurance company's website, I searched under ABA, and they didn't have anything. So everything would be out of network.
Yeah, they're right now. They're building those. From what I understand, they're building those networks right now, and to some degree, I can understand this. This is not anything that they've ever covered before. I'm pretty confident that you'll have a robust network in the metropolitan areas. What's going to be really challenging is if you live in Knob Noster or you live in Nixa, Missouri, and the ABA providers are they're a lot fewer and farther between. And so that's where the real challenge of the coverage aspect of this is probably going to be seen. But I think you've got enough providers around here that most folks are going to see a pretty good network. But to answer your question, they're building that network as we speak. What I'm told. Yes, ma'am.
What about psychiatry and psychology? Is that generally covered the same way that speech and ABA and so forth? Would that be covered as well?
Yeah.
Psychology, psychology.
The psychology question, though, I'll come see you before we leave. I'm not sure whether you have to get the psychologist through the medical doctor or not. I think you do. The psychiatrist would be covered in the context of part of the treatment plan, or if that person is the treating physician. The psychologist, I'm not sure, because the fellow at Stephen Canny at the Thompson Center is a psychologist. I don't think he's a medical doctor. So access to Stephen through my insurance plan would have to be based upon my pediatrician, including Stephen's work in Will's treatment plan.
You have time for one more question? Anybody else?
Yes, sir.
Two more, Ann, come on.
All right, two more questions.
We owe the employee benefits lawyer a little more leeway. The corporate guy was.
I'm actually a corporate guy. And over here, and that's it. Go ahead.
It says that the treatment plans are subject to review in 6 months. I don't know if this is an easy answer, but are the insurance company going to use doctors that are educated in autism, or are they just going to, just have some doctors there that they have, they have the MD behind their title, but are they actually educated on autism?
I believe they're required to have their independent boards like they have for other like when you're if you're diagnosed with cancer and they have their independent boards review those treatment plans. I believe that's how they will review these issues. But I will tell you, that was actually at the end. Now that you're saying it, that was a big point of contention at the end as far as what the bill looked like. The 6 months review is consistent with every other state that's done it, but we had to fight for 6 months. I mean, some people want it every 2 months or 30 days or 60 days, or and so we had to be mindful of that. But I believe they'll go through the independent review as they do with other treatments.
I do think, though, it's important. Again, the physician is not going to be able to gather and collate and organize the data on what's happening under the treatment plan. So if you think about your return visit to the doctor or the well visit, if there's going to be that review at 6 months instead of 12 months, you need to go back with data showing what's happening. Because if nothing's happening with this particular therapy, you should expect to have it kicked back. Now, we're going to get into arguments of why people hate lawyers, I suppose, because they'll say that nothing's happening. You'll say, well, how in God's name can I tell whether anything's happening if I just implemented a plan 6 months ago? I mean, my child has to be given at least the benefit of an academic year, maybe.
Implementers? I know implementers were specifically carved out of licensure, but how are implementers and consultants how did you guys envision that working so that I know if the insurance company's giving us the right
So the hook there, they're kind of like after the doctor prescribes ABA, in order for the insurance company to be obliged to reimburse for the work of a board certified behavior analyst, so the line therapist is another phrase that we used a lot, has to be supervised by the board supervised behavior analyst. So, in my case, we had a woman who was a board certified behavior analyst supervising Will's plan from somewhere in North Carolina, and she would come in once a month and then would go and sit down with a group of people we gathered to work with Will, so there would be 3 or 4 people, and we'd go over all the data in the 40 hours a week that those therapists work. So that reimbursement for that work is required, but only so long as the line therapist is supervised by a board-certified behavior analyst.
And the debate there was insurance companies wanted those line therapists to be licensed, which would have been inconsistent. I don't think any other state does that. And moreover, the way I likened it was to sort of a doctor's office. The doctor bills for all of the things that happen in that office because the doctor is supervising the care. So that was the analogy that we gave. So as long as the line therapists and the implementers are being supervised by the licensed ABA therapist, it would be covered. So that's what's in the bill.
So supervised, I'm sorry, go ahead.
But that was also the rural senators and representatives are like, good Lord, if you required a board-certified behavior analyst, we don't have any.
It's much higher.
So that they were on our side insofar as they're like, well, if there's a BCBA in Glendale supervising somebody in Noster or Poplar Bluff, that's fine. But if you say it's the person delivering the services has to be licensed, nobody's going to get any services. I think the number in the state of Missouri is less than 100 board-certified behavior analysts. I mean, if that's
right. So supervised, does that mean that the BCBA has to bill the insurance? Like, what does supervised mean?
So the reimbursement part is the reimbursement for the line therapist will go through the provider. The provider will be the board-certified behavior analyst.
She's in essence employed.
Right.
The implementers.
They'll
Because right
have
now,
to-
most of us are directly employing implementers.
Right.
Billing is separately done.
But you could have you could have an independent contractor agreement.
Right, so she could sub it out, I guess, subcontract it to
Yeah. Because if we would have went the other way, and all those, we would have lost coverage for somebody because all those folks are not board certified and they wouldn't have been getting any reimbursement. So we had to kind of go back to the sort of supervisor.
So,
We're not gonna kick anyone out.
no, we're not. But I just wanted to say, I was thinking back here, the ARC, this is our 60th anniversary. And it started with 4 families who got together and provided services, provided volunteer for 20 years. For 20 years, everybody did grassroots. And in this country and across the nation, it has always been families who drive all supports and services. And it is such a testament, I think, with Bill and the senator here, that again, it's families who are pushing, and I want to give them all the thanks for what they've done tonight, but I also think that the families out here need to give themselves a great big hand, because you did something that is part of a movement across this country. So let's just clap for all the families who made this happen.